So when you look at the word meningitis, there is meninge and itis at the end. So meninge refers to the meninges, and itis at the end refers to inflammation. So inflammation, in simple terms, inflammation is basically the body's response to something such as infection, injury, or irritation, resulting in swelling, pain, redness, or loss of function. So when you hear the word inflammation or inflamed, you just know that it means there's an infection, injury, or irritation. So before we define meningitis, let me give you a brief overview of the meninges, where they are located in the central nervous system, and their functions also. So the meninges, these are three protective layers that surrounds the brain and the spinal cord, and they play a very huge role in protecting our central nervous system. But unfortunately, these layers, they can become inflamed, and when they do, they can lead to serious complications that you are going to see in a patient who has meningitis. So how do we get to understand meningitis? We have to understand the layers and to look at each of these layers. So first we have the pia mater. So this is the innermost layer, and it is attached direct to our brain and spinal cord. So secondly, we have the arachnoid mater. So this is the middle layer. And lastly, we have the dura mater, which is the outermost layer. So between the arachnoid mater and pia mater, there is what is called the subarachnoid space. So that's where the cerebrospinal fluid is found. But we'll talk about the cerebrospinal fluid in a moment. So how are we going to define meningitis? So we can simply say meningitis, this is the inflammation of the meninges, the membrane covering the brain and the spinal cord, characterized by neck stiffness, fever, or photophobia. So that's how we can define meningitis. So let's look at the classifications of meningitis. So meningitis